So I'll be covering a visual evoked potential. It's a miniature of the electroencephalography, where multiple electrodes are placed along the scalp to detect seizures. Similarly, here we isolate the area of interest is occipital cortex. So we place the active electrodes at the occipital uh, lobe area near the skull, and the reference electrode at the forehead, and the ground electrode is placed at the mastoid area. So these are the electrodes used. So we have three types of VEP. We tell as flash VEP. So in child where they can't fix properly, the flash of light is shown in the bowel, and the pattern onset and offset and pattern reversal, where the checkerboard black and white is replaced by white and black. So here also you can see this is a 1 degree and this is a 0.25 degree. The patient who have a very good visual acuity, even 0.25 degree will give very good result. So we need to know only the two variables very important in VEP. So one is we tell latency and the amplitude. So it should be amplitude varies from 5 to 35 microvolts. So as you age, the amplitude may be reduced. And VEP, we have to look at the latency of the P100 wave. So if it is more than 100 millisecond, so we tell latency is prolonged. So these two variables itself, we can diagnose various neurological conditions associated with this. So we'll move to the examples first. So here you can see the P100 wave. Latency is 92 millisecond and the amplitude is 37. In the left eye, the amplitude is 38 and the latency is less than 100 millisecond. So what is the VEP report says? Whether it's a normal or abnormal VEP report. So it's a normal VEP report. Okay. So in this case, I told you have to look at the P100 wave. You can forget the other waves. It will be confusing for you to remember so much values. Okay. So here the amplitude is 7, but latency, if you see, it's more than 13 milliseconds. 100 milliseconds is the normal value. So here it's a 130 millisecond. And compare the left eye. So here also amplitude is a little bit reduced, but still in the normal range. But you see the latency. So 133. So 33 millisecond is extra. So here both the eyes latency is prolonged. So what is the diagnosis here? So it may be a case of demyelinating disorder. So in this case, you can see the disease morphology itself. So the amplitude is highly reduced in both the eyes, but latency you see 100 millisecond. So where you can see this in eye disorder, see in ischemic insult. Okay, the latency will be normal and the amplitude will be reduced. So in case of bilateral optic atrophy. So in this case, latency is normal in both the eyes. Again, amplitude is reduced in both the eyes. It's a case of ischemic optic atrophy. So in this case, you can see there is a reduction in the amplitude as well as increase in the latency in both the eyes. So the amplitude is less than 5 microvoltage and the latency is prolonged more than 11 milliseconds. Okay, so it may be a suggestive of a traumatic optic neuropathy or a space occupying lesion. So we can diagnose preclinically if you are going plan for neuroimaging again. So we have a modified form of VEP. So we keep multiple electrodes over the occipital lobe to pick up, because there are several millions of nerves are there. So we can identify the millions of nerves in one single graph. So you can put red eye as a red and left eye as a blue, and you can see how the wave patterns are improving after treatment. So here the waves are flattened, then after treatment, the waves are having good amplitude and the latency is decreasing. Thank you.